be brain powerful. It's a great phrase, but what does it mean? What is the point of this campaign? That's the first question I'm going to ask. What is this campaign all about, Meryl?
Well, the campaign we were attracted to it as the Global Alliance of Women's Brain Health because we felt it was an opportunity to change a conversation. And I must note that the conversation will be directed at women because we're disproportionately impacted by the disease. That it took men who champion women, like the Bradenberg Foundation and the Global CEO Initiative on Dementia, to support us in the early stages so that we could get off the ground. So thank you to the gentleman in the room and the wisdom of making an investment in women. As it's been said by Melinda Gates, invest in a woman and she'll bring everyone with her. So that's our goal, but the idea is, how do we take an issue that has such pain attached to it and extend a conversation to a generation that assumes their brain span will match their lifespan? How do you incorporate all the messages from the Finger study into a conversation by both aspirational conversations with the younger generation, and why women? Because women are the chief medical officers in their families. We make 80% of the healthcare decisions.
So, Meryl, concretely, what can you do to offer to people, to women, a chance to be brain powerful? What is it you're telling them they could do to be brain powerful?
I am carrying the advice of both Be Brain Powerful from AARP in terms of the science, and Mia's science in the background of risk reduction. That's what the conversation is. Own it. And when you move to the prevention space, all of a sudden, the diseases blur. What's good for the heart is good for the brain. All the issues that disproportionately impact people become connected. So you understand why the WHO steps forward and says, these are the important things. Behavior modification, as we all know, we all start diets at the beginning of the year, is very difficult to sustain. So the idea is, how do you own it? And in the age of precision medicine, this information becomes very important, and also the differences between men and women is a very important conversation. So we're on the agenda at the G20, at the WHO, and at the United Nations. And our honorary chair is First Lady Laura Bush, who has taken it up. And we're going global here for a very important reason, for your work in dementia care, for the reality is, and this is a very important point, we've talked about prevention. We must never insult the generations that came before who were struck by this disease. It is a disease. We are trying to stay healthy through these new strategies until the science catches up. So it is with great respect that we honor and care for our loved ones with the disease.
Thank you so much, Meryl. So Sarah, put this into a broader context for us, this campaign in the context of public health.
Sure, so Be Brain Powerful is focused on women and individuals. So sometimes causes get so big, it's hard to wrap your mind around what you can do. So the Be Brain Powerful campaign is something that is tangible, that you can think about, that you as a person can do and can own, and not necessarily be terrified because you're talking about your brain health. But you need to put that in a bigger frame, right? So it's what individuals can do, what states, what nations, what local communities, and globally what we can do. And so the Be Brain Powerful campaign, AARP joined that to think about individuals. But in the larger context, it's individuals joining together in their local communities, addressing it so that communities can foster healthy choices, so that large organizations like the CDC, the Alzheimer's Association, and the CDC join together to create the Healthy Brain Initiative and the Healthy Roadmap. and then tailoring it to specific communities of different cultures so that they can relate to what this means. And this raising awareness is absolutely critical because people think that there's nothing you can do, that dementia is an inevitable consequence of aging. And it's just not true. It's not to say that if you engage in healthy lifestyles, you can absolutely prevent dementia. No one's saying that, but you can reduce your risk.
Absolutely, as we've been hearing today. So, Anna, your company, USAgainstAlzheimer, is joining this campaign. It's being launched in Sweden. What are you going to do in practice? How are you going to use these tools and these ideas?
Well, in case of anyone is unfamiliar with USAgainstAlzheimer, we've been around in people's life for over a century. We are a big, innovative company for opening solutions, locks, for home, businesses, and institutions. We are in the business of care, protect, and secure our clients' most valuable items. And in respect of that, we also are in the business of caring, protect, and securing our most precious resources, our employees. And coming from a male-dominated company such as USAgainstAlzheimer, we need to make sure now to raise the women. We need women to be seen and to be heard and to be promoted throughout the organization. And being a part of this Be Brain Powerful is just for us ideal, it's necessary. And I think, for my part, I want to be the ambassador here in Sweden. We are actually the first Swedish company here in Sweden to be ambassador to Be Brain Powerful. So what are we going to do? Well, we're going to do a big marketing plan internal to make sure that each and everyone knows about this. We're going to have a big kickoff in September, which is actually the month of Alzheimer's. So we're going to do that, and then we're going to have small meetings here and there. We're also going to implement the 30 days challenge to our company, and I'm going to make sure that this is going to be a success here in Sweden because our company is global now. We started in Eskilstuna, but now it's as big as 47,000 employees globally. So I want, of course, this to be a success so I can take it even further. And I also want to challenge each and everyone, all the businesses here in Sweden, big one and small ones, to start to normalize this discussion. That is so important. This should be as normal to discuss as going to the gym 3 days a week, or sleep 7 hours a night, or eat healthy food. We need to start to normalize this discussion and be aware of this disease.
How wonderful it is to have a champion like you in USAgainstAlzheimer, completely outside the dementia world. So Professor Miia, tell us about the science of this. Why are women so vulnerable to dementia disease? Why does the burden hit women this way?
Yeah, this is a very good question, and before going there, I would just like to highlight that it's so important to have this action plan. We need it. Normally it takes 15 to 17 years before we start implementing the results. We can't wait so long time. This is an urgent situation, so I really hope that with this campaign we all can start moving and implementing the
So
results.
it's working together, it's taking the finger results and running.
It's like one hand and the fingers. Physical activity, cognitive training, social activity, diet, and taking care of the heart health. And this is what it is. So I really, really like it, and I'm so happy that we can do it in Sweden as well. That's great. So that also, I think, highlights the need. Why women are having the higher risk of dementia. And we still do not know.
And it's much higher, right?
Much
Give us the
higher,
numbers.
especially among the persons or elderly persons 80 plus. After the year 80 years, women have much higher risk. And this is a big issue because more than 70% of all patients with dementia are older than 80 years. So if we are thinking the future, big part of the patients will be women. And what is
for
the
a very
reason?
long time people thought this was because women lived longer.
I know, and that's one of the reasons. We have more time to develop dementia. That's one of the reasons, but it's not the only one. So there are probably some biological reasons, hormonal reasons, maybe lifestyle. And that is something I think we should study much more. Are there some lifestyle factors which we can affect? There have been a lot of focus on psychosocial factors, for example, stress, burnout, depression, sleeping problems, and we know that women are prone to these challenges, especially at some phases at the vascular risk factors, and the management of those is also different. Hormonal changes, so there are a lot of different factors which may affect. To really study this further, we need big data and we need harmonization, which I mentioned earlier. I want to take the challenge to use the worldwide figures to study this more. We have huge amount of persons there. We have different cultures and different settings. So I hope with this campaign we can also get more science to study this important issue.
Okay, so do we look at this on a gender basis? Is dementia studied through the lens of gender?
There are a lot of studies, and I was surprised to see that so little studies have been conducted to really see the gender differences. There are studies. Often the limitation has been the small sample size. When you have one study and you try to see the differences between men and women, the sample size is so limited that you can't really draw any form conclusion. So again, it's the big data. Data is there. That's not the question.
So
we just need to study.
By expanding finger, there are these 20 all around the world, as you say.
Yeah.
Will you now have enough data? Will you have to be able to say, okay, this is the men-controlled group and these are the women?
Absolutely. We will have more than 20,000 persons or even more in the worldwide figures. If we manage to harmonize the outcomes, we can see that. And I think it would be very interesting to study the cultural aspects globally in different countries. What are the roles for men and women? What is the vascular and other risk factor burden? So absolutely, we can do it, but we need to put focus on that. It will not happen automatically.
Okay. So Meryl, what's the significance of bringing Be Brain Powerful to Sweden? What are your hopes for how this campaign will take off and fly here?
Well, it's appropriate because you're the Center for Dementia Care. The sensitivity to exporting globally. 22 years ago, it did not exist. There was such stigma about the disease. So it's the quality of care and respect that goes forward. That's number one. Number two is, when you look at our children, they are watching us take care of our parents or a spouse, and they fear for their future. So how do we keep them from feeling helpless? This is the opportunity. And every country should own the campaign their way, with great respect. It has to be owned and celebrated, and it doesn't have an agenda. So where do we get the best science? The science that's evolving really comes from the Council on Brain Health. We'll take your science and we will showcase the best. And let's add technology. We talked about innovation. The mobile phone is what I call our mobile mirror, because with it we can begin to track our cognition. So if we do exercise, or we do eat right, well, my score may be better. And what if we attach it as data to the Karolinska or institutes globally that can combine the data? Look what happens. It is a multiplier effect that we will not get otherwise. And everyone, no one has to be trained on their phone. We never leave it behind. Why not deploy it? So at the Karolinska, under Miia's consultation, they're developing assessment tools. Let's take it and make it mobile so we can all do it and add to the Karolinska. So the model of care and the science makes it ideal for a place to start and model. So for the rest of the world. So thank you for the opportunity.
Great, so you're a crucible here in Sweden. So Anna, I understand both your grandmother and your great-grandmother
Yes.
had dementia.
Yes.
So it's a personal thing for you, right?
It is definitely. I mean, I think behind every title, whoever you are, there's a person. There's behind it. And for me as well, I have my great-grandmother had Alzheimer's, and my grandmother had it as well. And I remember still when I was a 10-year-old little girl, and my grandmother took my hand in one hand and my mother's hand in the other one, and we actually walked in through the door to the elder home for the first time. This as well, as you said, Claes, we were separated, my grandmother with my grandfather, which was terrible. And I could still remember the fear in her eyes that this wasn't good. I can still also today see my mother's eyes of fear when she got a call from the elderly home saying that my grandmother was missing. They didn't know where she was. This was in the middle of January here in Sweden, and it's freezing cold and it's dark. And today, of course, my grandmother is no longer with us, but I'm so proud to be here to represent her and to represent my mother who took care of her, and also to be here as a mother myself for 3 small boys. As the campaign say, I want to be like me when I grew up. And I want to be with my boys and maybe someday also to be a grandmother. So that's why also I'm so proud to be here representing a company, ASABLOY, that really takes the responsibility to start to talk about this issue.
You're a great advocate, I say it again. So Sarah, how do you hope that this campaign, Be Brain Powerful, will add momentum to the advocacy efforts that are going on in this area to put dementia out there?
It's fantastic, because if you think about this as a women's issue and owning your brain and the ability to do something, and you look at the people in this room, the first ladies, the queens, their majesties, these are the leaders who can persuade people to change their viewpoints and to revolutionize care, making it a women's campaign where 2/3 of the people providing care are women, to 2/3 of the people who have dementia are women. Whether you are a woman, you were born of a woman, the idea that this is a women's issue is incredibly important to build a movement. And that's what we need to do. We need to build a movement like we have done in the past for AIDS or disability or cancer, and think about it as the positive things that we can do together. And if we can empower women, we can change the face of this disease.
If you can empower women, you can change the face of this disease. I think that's a nice quote from the day. Who would like to put a question or add their voice to this discussion about Be Brain Powerful? Very appropriately, it's a young woman. Tell us who you are, and please raise it quite high up.
So, thank you very much for the panel discussing Empower Women. So I just want to add to the discussion about differences between men and women, especially facing dementia, Alzheimer's disease. So I'm a researcher, I'm a neuroscientist, and I recently just published a scientific article reporting the big data, different kind of big data. So we look at the fingerprint of about 100,000 cells from human brain samples. And half of them women, half of them men, half of them have dementia, half of them no. And what we found really struck me is the fact that women show very different signature than men. The certain signature is women specific and disease specific, and also there are certain pathology in the disease that women show much stronger degree of progression of this particular pathology than men.
So from this work that you're doing at the moment, would it be premature to leap ahead to come to the conclusion that eventually, if we do have disease-modifying treatments, they should be gender-specific or more gender-targeted?
That's what I was going to suggest. I would love to encourage people to now think about the disease that it could be different in women than men, and think about drugs in the future that perhaps specifically that can help women more than men, and also the evaluation criteria that we have to consider gender as well.
Thank you very much. Professor Miia.
Yes, I fully agree, and I would also highlight that studying the gender issue is not only that it's good for women or men, it can open totally new avenues for the interventions, because now we are thinking that Alzheimer's disease is one disease. Maybe that's not the case. Maybe there are several subgroups of the diseases, and we need to tailor the interventions more for these these separate profiles. So I fully agree that this has a huge importance.
And we've got an intervention here, Birgitta Martinsson.
Yes, hello. Hej på er allihopa. I'm Birgitta Martinsson. I'm from Switzerland. I'm here because I'm on the board of Alzheimer's Disease International. Question, how would you behave with me if I told you I have dementia? When we go out of this room, what would you do? Would you come up to me, take me to the room, take me to the loo? Would you? Or would you rather turn away from me? Because you don't know what to do, because you're very embarrassed. I want to know what you say about stigma. And I will ask you all, also the panel members up here, to fill in the survey that Alzheimer's Disease International has launched about stigma and dementia. And to tell yourselves that the problem with stigma is much bigger in low and middle income countries than here. And if you imagine the women in these countries, some of them are chained to a tree when they get dementia. So please, please, do fill in that survey. It will take you 10 minutes. Promise, promise.
We promise. We promise.
Yeah, please do. And tell people around you. Spread it. Please help us with more. The more answers we have, the more credible we are.
So we have another passionate female advocate.
Thank you.
Thank you. Do you want to comment on that, Sarah? Do you want a quick comment? I saw you nodding vigorously, Sarah. Or...
No, I just violently agree.
Okay. Professor Eriksdotter.
And this is above politics. It is not a sexist conversation. It really says that when we begin to look at the sexes, we benefit both because we see the differences and can address them. And look at cardiovascular disease. It was transformational when they began looking at women and how we present for both diagnosis and treatment.
Yeah, and the stigma, if we are talking more about brain health and the positive attitude, that may also help.
And blow past stigma with the positive message. Yes.
Professor.
I'd like to put a little bit other perspective on your campaign. I think it's really fantastic, but I also think maybe we should also include...
Professor, a bit louder and a bit closer to your mouth.
I think the campaign is fantastic, but I think maybe we should include also people who already have dementia. I'm also heading the Swedish Dementia Registry, which is the world's largest database on people with different dementia disorders. We have around 86,000 people in that registry. And when we merge it with other registries, big data, we get a lot of interesting information. And for example, as a gender difference, we've seen that women are diagnosed later in the disease than men. They're also diagnosed with fewer investigations than men. Women with Alzheimer's disease are also treated with less dementia medications, but they're more treated with psychotropic and anxiolytic medications. And also, since you bring up the cardiovascular thing, it's interesting because those with dementia and cardiovascular disease, all patients with dementia are getting less treatment for cardiovascular disease as a whole, but women even more so. So there are gender differences here that I think are very important also to address and do more research on and include the whole disease spectrum and the risk reduction.
Yes, that's a very important point. Thank you very much, Professor.
Yeah.
Would anyone like to pick up on that? Sarah?
Just a short comment that I think the management is very important. We also aim to have for the lifestyle interventions, we have patient groups involved. So I think we should highlight this even more. Thank you for the very good comment.
And I just want to add that behavioral differences, like what will work for women to change their behavior, might be different than men. So we need to understand that. So ARP has a digital platform that we've designed for both men and women. And to your point, that including people with dementia in this conversation about intervention and prevention is really important because people live with this disease for 20 years. So what you do in stage 2 or 10 years into the disease is critically important to how you progress through the disease. And so it's really an important point that we have to include people with dementia in this prevention conversation as well.
Madam First Lady, would you like the mic?
I understand perfectly all the difference you say, especially in the medical or different genetical and biological difference between men and women. But do you think that cultural changes in the behavior of women and men, especially for us medium income countries, that we have changed later than European or Occidental countries in our roles, would it affect maybe now that women and men are doing almost the same roles and activities? Because before women were more at home, maybe they didn't exercise a lot, their brain, they did a lot in emotionally exercises, but maybe working in, being in another fields, like engineering, I don't know.
Yeah, and
Do you
catching up
think
with
that will
education.
help, that will change this map?
Professor Miia.
This is an excellent question, and indeed, education, lower education for women traditionally in many countries have been one explanation which could be there, and even that men has traditionally have been maybe having more mentally occupied or mentally stimulated occupations. Now it has been changing, at least in some countries, but not yet globally. So I would say that increasing the educational level for women globally is absolutely very, very important for the future brain. Lifestyle factors, there are positive trends in many countries, but unfortunately in some countries, even in Sweden, smoking is still increasing, especially among women, harmful alcohol drinking. So there are also the harmful, unhealthy lifestyle factors. Stress, which I mentioned, is also one of them. So there are much to do in this area.
Professor Utterson.
I think it's important to respond to the question about stigma, because we should not only look at the patient, but on the patient's social fabric, as it were. And being a physician myself, I've seen this challenge on close range. And here is where education comes in, and culture, of course. And we're speaking about education not in general terms, but also education of health professionals. We need to understand that this disease impacts the social fabric within which the patient shall continue to live with dignity and respect. This is so important, and we must not miss that.
Thank you very much. Okay, one last voice. You know, ladies and gentlemen, this side of the room is definitely more active. I hope it's not because of bias on my part. Please tell us who you are.
Yes, thanks so much. Oscar Sotter from Germany, from the Malteser Order. I'm so happy about the discussion ongoing now, because it's 25 years ago that in Beijing at the World Conference, it was one of the main results platform for action to look for gender in medicine. And what Professor Eric Sotter described for the dementia, we have this challenge in all kinds of medical service. So the access to health in many countries for women is different than for men. And I think our challenge is to sensitize the medical area, the health sector, for the gender aspects. Because we don't know what is going on in the early years for the assessment, the different kind of treatments. And for instance, in Germany, it took, after the Beijing conference, 8 more years, and then it was decided by legal regulation that for the new medications, we need gender studies, because men and women are different. I think this is not really a new knowledge, but I would like to support this activity for women's health. Congratulations.
Thank you very much indeed. And I think we all support you wholeheartedly. Shall we put our hands together to say a big thank you?